I'm here with Senator Dan Laughlin, a Republican from Erie. Senator Laughlin, can you tell us a little bit about the situation with COVID-19 in Erie County right now?
Well, sure, Kes. We are actually pretty fortunate. Our county has been largely spared as far as total number of positives, and I believe I think we're at 2 mortalities or fatalities so far. So, I mean, by and large, we've been pretty well protected up there in our corner of the state, which has, been very fortunate for us.
And what have the biggest concerns been from your constituents, and what have your fellow Senate colleagues been hearing from their constituents about their biggest concerns?
Well, it depends pretty greatly on what area of the state you're from. My constituents' issues are, vastly different from those like in Bucks County and things like that. Early on, I think everybody was really worried it was going to be bad like Italy. And then as it hasn't panned out like that with these shutdown orders, we've had, at least at my office, just an absolute ton of small businesses calling. They want to get back to work. They feel that they can do it safely. And I think that there is a path there that we can do both, that we can stay safe, but we can open the economy. And I think all of Pennsylvania wants us to find kind of that happy medium, if you will, or that middle ground where we can keep the economy going, but keep people safe.
And what have you and your Senate colleagues been doing to help address those concerns that people are feeling?
Well, some of your listeners may have been aware that we passed Senate Bill 613 about a week and a half ago and sent it to the governor. That would have opened most of Pennsylvania's economy following CDC guidelines. And I realize, there are folks that think that was too soon and folks that think that it wasn't soon enough. And that's kind of that tough tightrope that all of us elected officials are walking right now. The governor vetoed that bill. He has his own plan, and I understand, he's the governor. He has a lot of say in what happens in this state, obviously. But I think that 613 would have been probably a little better way to go. That's all. I mean, that's a difference of opinion.
And what have you seen from Governor Wolf's plan that maybe you'd want to change and to help your constituents open back up again?
Well, I think probably the biggest difference that Governor Wolf and I'll just speak for myself here. There were a lot of businesses that I think never needed to close. There's some that obviously did, some of the restaurants and whatnot, where people are sitting very close to each other. But we were the only state in the country that closed all of our construction activities, and that's roughly a third of our unemployment numbers. So that was a big portion of the economy, the shutdown, and I believe that we could have kept that open and been, relatively safe in doing that. And then there's a lot of just like mom and pop type places that could have stayed open as well. We have Lowe's and Home Depot open as just examples, and people are flocking there. It seems to me like a mom and pop convenience store could have stayed open as well. And that would have helped our economy a little bit too.
Now, you've recently called for increased monitoring of employees who work at nursing homes and long-term care facilities. Can you explain why you've called for that?
Well, sure. I'd be happy to. And the numbers continue to get a little bit worse. The latest numbers I saw today were up to 65% of all of our mortalities are in either personal care homes or nursing homes. And, it's not, I don't think it comes as any surprise to most people that that's where our most vulnerable population lives. They have the most health care issues. And, they don't recover from stuff as well as younger folks do. So having said that, I think it's more appropriate to put some of our resources towards the testing and protection of those homes rather than testing, just for example, a 25-year-old that has a fever. And it's nice to know if that person is positive for COVID, obviously, but they're probably not at very great risk of dying. And and until we have enough tests, and that's everybody's goal, obviously, is to have more testing capabilities. But until that happens, at least in some of these hotter counties, I think that we could be testing the employees and vendors that are heading into these homes, because the residents have been quarantined for about 2 months now, so they're not going out and getting it. So the homes that are having the positive cases sweep through there, the virus had to come in from somewhere, and that seems like, it seems pretty logical that that's how it's getting in.
So how do you envision this increase in monitoring happening here in Pennsylvania?
Well, the Department of Health obviously would have to weigh in. I spoke to Dr. Levine about it, and respectfully back and forth. It's not my way or the highway, or Dr. Levine's way or the highway. Well, I guess it's probably a little bit more her way since she runs the Department of Health, to be fair there. But these are the dialogues that we need to have. And, after we had that hearing, there was a little bit of news coverage of my comments. And then I saw that the head of Harvard's medical school actually said virtually word for word what I said, that's what we need to be doing as far as protecting the elderly, since that's where most of our deaths are occurring. That was kind of nice to be backed up by Harvard Medical.
Now, as you mentioned, there was a hearing last week in the Senate. Can you talk about who was at that hearing and your questions to those speakers at the hearing?
Well, involved in the hearing was Dr. Levine from the Department of Health and Dennis Davin, who is the head secretary of DCED. And, it was a two-pronged hearing. Some of it were health questions, and a lot of it were business questions. The waiver process, I don't think most of the people that needed waivers thought the process was running very smoothly. I'll put it that way, keep it kind of polite like that. There's been very little transparency on the waiver process. We still don't know who got what waivers and why. I have tons of small businesses that were, applied for waivers and never even heard back from the department. And that's fairly problematic given the gravity of the shutdown and the survival of their businesses. And I think that we need to do some more work on that end.
Can you talk a little bit more specifically about your questions to Dr. Levine and what her response was?
Well, I had suggested that we have roughly weekly testing, or maybe every other week, depending on the availability of testing. I think Dr. Levine misheard me and thought I said daily testing. I don't think anyone thinks that daily testing is feasible. But at weekly testing, I think the thought process is, at least from my end, is that since so many people seem to be asymptomatic, at least for a while with this disease, that we could probably at least catch some of the positives that aren't showing symptoms yet and get them out of the, so they could go home and self-quarantine for a while. And, that's it. I mean, it was a simple thought process. It wasn't, I'm not a healthcare professional, but it seemed to me pretty logical that this would be a little bit better way to protect our elderly.
Now, is there anything else that you'd like to know from the Wolf administration and the Department of Health about how to protect the citizens of Pennsylvania, and then further how to reopen Pennsylvania once COVID-19 is in a better state, I guess I should say?
Well, sure. This is going to be with us for a while. I know there's a lot of really bright people working on vaccines and different things and treatments, and that's good. But we need to find a safe path to opening the economy, because we can't just stay shut down for a whole year. It's not feasible. So having said that, I think we need to work together to decide, what the parameters are for a business to be able to open safely without needing to go through the waiver process. If you lay out the guidelines and a business is meeting that, they should just be assumed that they can stay open. And I think, given the fact that, manufacturers around the world are ramping up their PPE production, I don't think having masks and stuff is going to be an issue for much more than another week or two, I wouldn't think. I mean, you can make a lot of masks once you get these factories running 24/7. And from what I understand, even on the healthcare side, the supply chain is getting, really ramping up. So I think that, it's just a matter of working together and having open, honest conversations. How do you want this to proceed? What's the best and safest path to get the most people back to work?
And as a last question, how can people keep themselves safe during a time like COVID-19 while also helping to reopen the economy and to get their businesses up and running?
Well, I think if there's a silver lining to this, I think everyone now, and part to Dr. Levine's press conferences, the hand washing and whatnot is stuff that people should have been doing right along. And I think we've seen a sharp drop in the flu deaths and stuff this year because of that. And if there's a silver lining that comes out of this whole thing, is I think every flu season now people will probably be a little more careful than maybe they would have ever been had this not happened. And if you look back 10 years from now, maybe we'll have a lot less flu deaths each year because of this as well.
Senator Dan Laughlin, thank you so much for your time.
Thank you, and thanks for having me on.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the Governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm here with Gene Barr, the President and CEO of the Pennsylvania Chamber of Business and Industry. Now, Gene, recently Governor Wolf has outlined a plan for slowly reopening the Pennsylvania economy. What does his plan look like?
Well, it consists of basically three different colors depending on how many infections are in an area: red, yellow, green, with green being as close to normal, I guess, as we can get at this point. So obviously, we are supportive of moving as quickly as we safely can, and I emphasize both quick and safe. It's one of the reasons why we've been advocating to adhere to the Department of Homeland Security, what are called CISA standards, which the overwhelming majority of states have done. But we're going to be working and continue to work with the administration on getting Pennsylvanians back to work as quickly as we possibly can.
So how would Governor Wolf's plan affect businesses here in the state and how they reopen?
Well, look, businesses are going to have to follow certain guidelines in order to reopen. It's going to be critical that businesses focus on a number of different things. First off, how we work to get our workplaces ready, and that will vary depending on whether you have a customer interfacing workplace, a manufacturing workplace, a professional. We also have to get employees back to where they're comfortable, in addition to customers back to being comfortable. All those things are one of the reasons why, for many reasons, we've launched something at the Chamber called Bringing Pennsylvania Back. We've been cooperating with a number of statewide associations, and that includes medical professionals, to assist us in figuring out how quickly we can come back and how safely we can come back. We'll be launching a website on that here shortly. It's getting the finishing touches. That will contain all the information that you and I are talking about here. What kind of guidelines are necessary for this? What kind of vendors can I use to sanitize my building? All of these things are going to be posted in one place so business can come in, find out quickly, we hope, how they get back to work, how they can get up and running, how they can get their employees back as safely and as quickly as possible.
So which partners have you been working with on that initiative, and how has this come together so quickly?
Well, we decided about 3 weeks ago that we wanted to begin having this discussion. So we've pulled together people like the Pennsylvania Medical Society, the Pennsylvania Manufacturers, the Bankers Association, the food merchants, to make sure that our food supply chain is safe. We've spoken to a lot of the local government organizations to make sure that we collaborate with them on how we do permitting and how we bring that back up. We've worked with people in the electric industry, the energy side, road building, construction. All of this we've pulled together for a couple of reasons. One, kind of get an idea, along, of course, with the restaurant and lodging, how badly have they been hurt by this? And of course, restaurant industry, lodging industry, just cataclysmic in terms of the losses there. And then get ideas from each of them, not only on the reopening, but what else do we need to do in Pennsylvania to make Pennsylvania more competitive as we come back so that we can attract more investment, get reinvestment back in, make sure we don't do anything that's going to block that investment. And so we've had a number of meetings already. Local chambers have been a part of that. They're an important partner of ours, and local chambers know their communities better than we do. So we're continuing to work with them on a regular basis, as well as the members and our partners in the statewide association group.
So what have the biggest concerns been from these different sectors of the economy with reopening their businesses, and how to make their employees as well as customers feel safe and comfortable when the economy reopens?
Well, look, there's so many. A lot of it is the uncertainty. We're dealing with arguably an enemy that's not only unseen, we've never dealt with before. People are still uncertain over how long the immunity will go. People aren't certain how to do the testing, where to get the testing. Even some of the getting the personal protective equipment that's necessary has been a bit difficult. Part of our work has been trying to get people to find the places where they can get that. And we've been working with people like the Hospital Association for weeks and weeks now to assist them. And we're now turning to get personal protective equipment for others as they go back and they're forced to wear masks and perhaps other equipment as well. So there's so much uncertainty out there. Of course, people want to get back. Employers want to get back, but they want to get back safely. They don't want to endanger themselves, their employees, or their customers. They want to come back and work, but we've got to find a way, and we will find a way of bringing Pennsylvania back.
So for those who are worried about businesses opening too soon, what would you say to them to help reassure them that this is the right path for these businesses?
I think that we're certainly all going to be cautious. Even when you go back, there's going to be a lot of social distancing there. We're all trying to figure out how we do that safely. How do we do social distancing? Some of the preliminary reports are that this virus will tend to kind of die off a little bit in the summer. Of course, people are concerned about that resurgence, so we'll have to watch that carefully. Here in Pennsylvania, I think we have an interesting test to watch. As you see South Carolina, Georgia, Tennessee, and other states come back, we'll be able to watch that and to see what happens. One, see how they did it. Two, see what the results are. If they come back safely utilizing these procedures, then I think we feel safe that we can adopt those as well.
Now, earlier I asked you about Governor Wolf's plan to reopen the economy. Now, Senator Toomey later came out with his plan to reopen the economy in Pennsylvania. How do those different plans compare, and what do you see as the main differences between the two? Obviously,
the governor's plan, going back weeks and weeks, he had it devised first essential versus non-essential. Then we went to life-sustaining versus non-life sustaining. We had a waiver system that we had some difficulties working through. It caused, arguably the Department of Community Economic Development to be overwhelmed, 42,000 waiver requests that they had to work through. Senator Toomey's plan is a little bit different in that it kind of assigns, can you work safely or can you not work safely? Can you come back in and utilize guidelines that will allow you to bring your employees back, to interface with customers? And look, we know now that essential businesses that have stayed open have pretty much operated safely, grocery stores, pharmacies, et cetera. What we encourage in our release when we heard this, and I heard a presentation, I think Senator Toomey's plan is reasonable. It's a responsible plan. Our view is that we need to get all of our elected officials together and hammer out a solution, because we are walking a fine line here between health effects and economic effects. And there are health effects and economic effects on both sides. The economic effects on hospitals, the health effects on individuals. And over on this side, we have the clear economic effects of one of, if not the highest unemployment rate in the United States. And we know that it will begin to have health effects too. We know that for every 1% increase in the unemployment rate, we will see approximately a 1% increase in the suicide rate and a 3.3% increase in the overdose rate as people become more and more desperate. It is incredibly unfortunate. So I don't envy Governor Wolf. This is a fine line to walk, but it's also one that we have to find that path and figure out what does make the most sense, where we can bring our economy back as quickly as possible, as safely as possible.
So how does Governor Wolf, the legislature, and business leaders help walk this fine line to figure out when we can reopen the economy and do it in a safe way?
It's communication. It's communication among everyone involved. You mentioned the administration, you mentioned the legislature, you mentioned business. I will throw in the medical community. It's looking at what we know we need to do, finding out as much as we can about this virus that we're dealing with, getting all the equipment together that we know we need to do, and watching what develops in other places as well. How are not only other states, but how are other countries doing this? What have they seen? What have they done that seems to be most effective in terms of dealing with this as they bring their economies back? I think we have to watch not only internally within Pennsylvania, but externally within the other states as well as other countries.
As you've been seeing how other states and how other countries are helping to reopen their economies, what types of things would the Pennsylvania Chamber like to see maybe happen here in Pennsylvania?
Well, we keep talking about getting open as quickly and safely as possible, so that's certainly part of that. I think it's just a matter of continuing to cooperate and gather as much information as we possibly can. For example, it seems that a lot that we thought about the virus at the outset of this, CDC was saying no need to wear masks. It looks like perhaps we could have knocked some of these numbers down, because it looks like there's far more people who are asymptomatic, that is, have the virus but don't show symptoms, than we thought at the outset. About 25 to 50% of those who have been infected. That's a very high number. So we're all learning all the time. I think what's important is let's not assume that we're certain about things at this point until we're absolutely certain. Let's gather all the information we can. Let's work with all the parties, pull all the parties together, and make sure that we get all sides of the discussion so we can move forward.
Now, for businesses that could potentially be opening later this year, what advice would you give to them to help keep their employees safe, to help keep customers safe while they're in these businesses?
I think you have to give every assurance to the employees and the customers that you are making it safe. For example, the Chamber is an employer. We have roughly 50 employees in downtown Harrisburg. We've already begun to talk about how we are going to get our employees back in. It'll be a phased reentry. To the extent we have employees who are sensitive, who fall into populations we may not want to expose quickly, we're going to bring them along slower. We're going to make sure that, for example, now that schools are closed, people that have childcare concerns, see if we can have them operate from home remotely as much as we can. There's still uncertainty over what's going to happen with some of the day camps that parents rely on to watch their kids during the summer. So we're going to have to all learn a whole lot from this, and a whole lot of that is going to be finding those things that give people assurances that we're operating safely and in a healthy manner.
Gene, Barr, thank you so much for your time.
Thank you.